Thank you, Mr. Speaker. I ask unanimous consent for all members to have 5 legislative days to revise and extend the remarks and include any extraneous material on the subject of my special order hour.
Without objection.
Thank you, Mr. Speaker. Mr. Speaker, I take to the floor today to raise the alarm for the people of Illinois' 3rd Congressional District. Today, I'm standing here for the 197,569 people, including 94,806 children and 22,000 seniors whose Medicaid is at risk of being taken from them. I stand here for the 69,000 people in Illinois 3 who count on SNAP benefits and could be losing them. I stand here for the 28,000 people who receive coverage under the Affordable Care Act and may see their average premium go up by $820 a year, a 40% increase. You see, Mr. Speaker, the working people of my district rely on federal programs and services, and they also rely on the essential Illinois 3 organizations that provide federally funded social programs and services. And so I stand for the 11 federally funded health centers with a presence in Illinois 3 that leverage $78,954,648 in federal investments for 624,770 patients. I also stand here in the People's House for CEDA, which provides LIHEAP assistance to 179,082 working people in Cook County to weather the extreme temperatures. I stand here for the Puerto Rican Cultural Center under the leadership of Jose and the AIDS Foundation, La Casa Norte, and so many in Illinois 3 serving organizations that meet the needs of our diverse constituents who are facing uncertainty about federal funding in this precise moment. My colleagues and I are standing here because my Republican colleagues have bowed down to the whims of an unelected billionaire and a wannabe dictator. They are stealing from the American people so that they can enrich billionaire bosses and expand their wealth at the expense of our working families. Consider that for a moment. The richest man in the world is demanding cuts in the services and working families and that working families rely on. The richest man in the world who could be making contributions to end hunger globally decides that we should be cutting program services for working families, many of which my colleagues will talk about today. But Mr. Speaker, as we stand here today in the People's House, I want to be very clear about something. I will not betray working families by supporting a budget that harms working families to make the rich richer. We have to stand up in this precise moment in the People's House. Republicans must also stand up to their billionaire bosses and do what is right, what they were elected to do, represent their constituents. We must protect and defend the federally funded social programs and services that the American people rely on. And now, I would like to be able to yield to my colleagues who will share about the programs and services their constituents rely on and that they were sent to Congress to defend. Mr. Speaker, I would like to yield to the gentleman from New York, Mr. Kennedy.
Mr. Speaker, first of all, I want to recognize Representative Ramirez for her leadership on this important issue. I rise today not just as a member of Congress, but as a healthcare practitioner. Like so many of my fellow healthcare workers, I became an occupational therapist to help people. Before entering public office, I spent over a decade working with seniors and children to help them achieve independent, full lives. Last week, the Trump administration made it harder for our healthcare providers to deliver the services Americans rely on by terminating 10,000 hardworking members of the Department of Health and Human Services workforce. Under this administration, a total of 20,000 HHS employees have been illegally fired, putting Americans at risk every day. These cuts do nothing for the people in Western New York or anywhere else across the country. They're a means of giving tax cuts to the ultra-rich and powerful, those who never have to worry about access to reliable health care. These cuts are more than numbers on a balance sheet. These are lives that hang in the balance. For Western New York, this will make it harder for Roswell Park Comprehensive Cancer Center or the University at Buffalo to advance their life-saving work. These cuts mean delayed treatments, denied cures, stolen hopes from patients battling cancer, Parkinson's, ALS, Alzheimer's, and so many other devastating diseases. I've felt the pain and hope of patients, grandparents, mothers, fathers, and children who are counting on the next clinical breakthrough to survive. These cuts say to them, your health doesn't matter. Your life doesn't matter. President Trump, unelected billionaire Elon Musk, and Secretary Robert Kennedy are more concerned with cutting services and pushing an anti-science agenda than they are with supporting and improving our healthcare system. By walking away from practitioners and patients, the Trump administration is abdicating its duty to our most vulnerable and signaling to the world that the United States is no longer the global leader in scientific research. As someone who spent years treating patients, I know that abandoning our scientists, our research institutions, our doctors and nurses, and worst of all, our patients, puts our entire community and country at risk. I urge this body, Democrats and Republicans, to stand up for our healthcare heroes, invest in breakthroughs that millions of lives are depending on, and restore the funding and workforce our nation's healthcare system depends upon. I yield back.
Thank you, Mr. Congressman Kennedy. I have the opportunity and honor to serve with you in the Veteran Affairs Committee. And every day I see the work that you do to uphold the work that is necessary to protect the benefits of our veterans. And I'm so grateful for the ways that you continue to show up for your constituents in New York and for the entire nation. It is an honor truly to serve with you. Mr. Speaker, this past Saturday, you saw constituents from every single state in the country come out to protest and rally. You saw children and you saw people who are probably closer to 100 years of age walking through streets, going to the parks, and asking other members of Congress, have you forgotten about the people that sent you to Congress? Well, I want to say, as we are standing here in the House of Representatives, that New York, that Michigan, that Texas, that Chicago has members of Congress who are unwilling to accept the idea that we would slash the very same programs that we promised to protect for the American people. And so today, I'm grateful that I get to be here with members of Congress, not just from New York, but also from with a colleague of mine who continues to ring the alarm for the safety net programs that our constituents here and in Michigan need and deserve. And so I'd like to yield for as much time as she needs to the gentlewoman from Michigan, Congresswoman Rashida Tlaib.
Thank you so much for the leadership, Congresswoman Ramirez, who has led with her own lived experiences and her compassion, that she leads with compassion, which I think is sometimes missing here in this chamber. But Republicans are advancing, as we all know, a budget that includes $880 billion in cuts to Medicaid to pay for tax breaks for billionaires. These are folks that do not fully understand what it means to live paycheck by paycheck. 60% of our residents in our country live paycheck to paycheck. Just so we're clear, the $880 billion cut to Medicaid, this is the largest Medicaid cut in American history. 72 million people rely on Medicaid for health care in our nation, including 40% of people in Speaker Johnson's own district. For families, seniors, and people with disabilities who rely on Medicaid, it is a difference between life and death, Mr. Speaker. But right now, the future of Medicaid is under threat. I've heard many of my Republican colleagues in this chamber try to gaslight the American people and claim that the budget does not make cuts to Medicaid. Well, Senator Hawley, as we know, just offered an amendment to the same legislation right now that came through this chamber to strip the $880 billion in Medicaid cuts out of that bill. And it was voted down by members of his own party. The amendment literally said, quote, to strike the section related to reconciliation instructions to the Committee on Energy and Commerce of the House of Representatives to cut $880 billion from Medicaid. And your Republican colleagues in the Senate voted it down. So let's be honest with the American people. If you're going to cut their health care, be honest about it. Don't gaslight and try to pretend. But those who rely on Medicaid aren't just a number. They're our neighbors, they're our friends, they're our families. They depend on Medicaid for health services, treatment, medication. They simply cannot afford due to our broken healthcare system. Make no mistake, Republicans want to give away trillions of dollars, Mr. Speaker, let's be honest, to the richest people in our nation, like Elon Musk and all of President Trump's friends, and let children and seniors die from the lack of healthcare coverage. But you know, as the chair of the Congressional Mamas Caucus, I need to bring this to light, because this is important when we talk about Medicaid. You know, Black Maternal Health Week begins on April 11th, Mr. Chair. And Michigan has one of the highest Black maternal health rates in our nation. Medicaid plays a critical role in supporting maternal health, covering a significant portion of births in our country, and providing access to health care for pregnant women, postpartum individuals, including prenatal care, Mr. Speaker, and postpartum services. So Black women, we know, are 3 times higher, are more likely to die from pregnancy-related causes than white women. And this is absolutely unacceptable. And we must address it at the federal level. But here we are, Mr. Speaker, here we are, because we have systems right in place, institutions that have failed our folks, but here we are saying, you know what? We're also going to take away your health care coverage. Cutting Medicaid, again, is going to be a life or death situation for our families, including women, birthing women. It's a result, of course, we know of different systems, of broken systems, but at this moment, when we know we have a crisis in infant mortality, we have a crisis in Black maternal health, we have a crisis in our healthcare system. It's a broken system. It's sick care, not health care. And here we are, watching again folks choose billionaires over the people that they elected, the people that elected them. We must raise our voices, and I'm glad and so incredibly happy to be serving with my sister in service, Representative Ramirez. We must raise our voice again because we have to defeat this dangerous Republican budget. Again, our residents deserve better. With that, I yield back.
Thank you, Congresswoman Tlaib. You're absolutely right. Our constituents, in fact, do deserve better. You know, as I go back to the district and I look at the emails and the phone calls that are coming through, our constituents are saying, what are you doing to defend me? What are you doing to protect the programs that we depend on to stay alive? You need to do more. And one of the things that we have said in our town halls, on the calls, on the emails, as constituents come to DC demanding that we protect these critical programs, is that we have to use every single opportunity. Be in committee, be in the conversations we're having with colleagues, and every moment we can get to the House floor and talk about what's at stake in this precise moment. We have to make sure that everyone hears that we are doing everything we can to protect these critical programs. Because many of our constituents in this moment are feeling that they're being gaslighted by the very same people that send them to Congress. And so it's important to hear from the champions that are taking a stand. And with us today, I also get to be with one of our newer members of Congress, someone that yields from the great state of Texas, where there are champions for justice who are fighting to protect Social Security, who are fighting to protect Medicaid, who are fighting to protect the very same programs that are critical and have made this country great. And so I would like to yield to the gentlewoman from Texas, Congresswoman Johnson.
I thank you so much. I want to thank the gentlewoman for yielding and hosting this important special order hour on a topic that impacts many of my constituents in North Texas. Since day one, the Trump administration has targeted essential social services that make government unreliable for all Americans. Veterans, people with disabilities, seniors, our children, all of these people and more rely on government to survive, and all President Trump wants to do is cut, cut, and cut. Let's call it what it is. It's a full-on assault of the most essential lifelines millions of Americans count on, especially Social Security, Medicare, Medicaid, that are in the crosshairs of this administration. The Trump administration and Republicans in this House are pushing cuts to the programs that Texas rely on every day. These aren't just numbers in a budget. They are the difference between stability and catastrophe for hundreds of thousands of my constituents. In Texas alone, more than 4 million people rely on Medicaid for health care, including half of the children in our state. Now, let me remind you, this is a state of 32 million people. Half of the children in our state rely on Medicaid. 1 out of every 2 kids in Texas. So when Trump proposes gutting it, he's not just slashing spending, he's taking away critical health care from children, from seniors in nursing homes, and people with disabilities who depend on it to survive. You know, today in the Capitol, one of my dear friends is here visiting who runs a hospice company. They provide dignity of care to people at the end of their life, necessary comfort for families as they're trying to deal with these situations. End-of-life care is the most expensive part of our healthcare system. But companies like hospice companies and they provide a necessary but much more affordable access to the end of life with dignity for families. And they rely on Medicaid. They rely on Medicare to stay in business, that help families and so many people in need. We still have to even talk about Social Security. Over 4 million Texans, retirees, veterans, widows, people with disabilities rely on Social Security to keep the lights on, keep food on the table, and pay their bills. It's not a luxury. It's a promise this country made to working people. If you pay in, you can retire with dignity. But Trump's budget says otherwise. He's talking about entitlement reform. That's Washington speak for cuts. Cuts that would hit rural communities, communities of color, and low-income seniors the hardest. Let me be crystal clear. Texas already ranks 43rd in the nation in access to health care. It's a statistic I'm not proud of from my state. We lead the nation in uninsured adults. You know, we also lead the nation in maternal mortality and infant mortality. 2 statistics the Republicans in our state should be embarrassed of. And now Trump and Republicans want to make it worse. It's cruel, it's reckless, and it's dead wrong. This isn't about balancing a budget, it is about priorities. Donald Trump's priorities are tax breaks for his buddies, while working families are told to tighten their belts. We should be expanding care, not slashing it. We should be protecting retirement security, not playing games with the futures of people who work their entire lives. Texas families are watching, and we will not let this administration destroy the programs that protect our health, our security, and our basic dignity. I urge my colleagues, especially my Republican colleagues, you represent the same people I do, hard-working folks, trying to make ends meet, trying to provide a life for their kids. If you went to your town halls, you should see people standing up, speaking out. They don't want this. The people in this country don't want this. And my message to you is that Democrats are standing up. We're doing everything we can to protect you, your family, and your kids, and the right for safety, justice, and your right to pursue the American dream. Texans and all Americans deserve better. And I yield back to my colleague, Rep. Ramirez.
Thank you, Congresswoman. You're absolutely right. Our constituents deserve better. So I want to talk a little bit about what is at stake. You've heard already my colleagues talk about Medicaid. You've heard them talk about Social Security. You've heard them talk about how their constituents are living in constant fear. Well, I want to talk to you about community health centers, which also are incorporated in the Medicaid funding that my colleagues, the Republicans, want to slash. And I want to start by saying to you unapologetically and very loudly that I believe to my core that health care is a human right. No one should have to choose between getting the care they need, accessing their medication, or paying their mortgage. But I could tell you from personal experience, growing up in a family where their insurance company, the insurance company they pay into, constantly makes it difficult for them to be able to get health care. Knowing that my mom and dad have had to choose often, do they get the medication or do they pay for the mortgage? You see, my parents worked their lives in this country. And my father today has Medicare. And my mother, up until a year ago, had Medicaid because unfortunately the wages that she worked were not large enough, were not equitable enough. They weren't living wages. But the Medicaid system that we have that we know isn't working for everyone, that we should be expanding, not cutting, made it difficult for my mom to continue to get Medicaid. And so I think about the challenges and the struggles that so many American people are living here. And I'll tell you that in the short tenure, we have seen that this administration has not talked about making Medicaid better. What they're talking about is cutting Medicaid. What they're talking about is announcing executive orders that target immigrants and the social service providers that work in strong immigrant communities. Immigrants that, by the way, pay into Medicaid that they never get. What they're doing is undermining local governments and local agencies who know best what their communities need. You see, community health centers exist to serve an entire community, regardless of their income, regardless of insurance status, and regardless of immigration status. And many of the services they provide, like emergency care, like vaccinations and public health outreach, serve the public good. Providing these services broadly in our communities keep us all healthy. Community health centers also make a profound economic impact on our communities, creating job creation, not taking jobs like this administration is doing, over 340,000 jobs and generating $118.4 billion in local economic activity. But Republicans have chosen to defund health care so that they can provide their billionaire bosses with more tax breaks. They want you to go without health care so that the top 1% of Americans can get a $314,000 tax cut. Let me say that again. They don't think that you deserve health care. They want to take your health care away. Frankly, let you die so that their billionaire bosses can get $314,000 in tax cuts. That's what they want to do. They claim to care for working people in our economy, but their actions show us just how terrible and in your face their hypocrisy really is. There are no other words for those who knowingly would put tax benefits for the wealthiest Americans over the working families who depend on Medicaid for their basic health care. You see, in Illinois, 772,233 adults are enrolled in the ACA Medicaid expansion. If Republicans cut Medicaid, these constituents would lose their health care. We have the obligation to remain defiant in our position that everyone, independent of citizenship status, zip code, or age, has a right to a dignified, healthy life. And now is the moment to remain united in our commitment to health care for all, courageous in our resistance, and undeterred in our fight against this administration's authoritarian agenda. And I want to talk to you about immigrants, because apparently my colleagues here do everything they possibly can to vilify them every single day. It's almost as if they forgot that their grandparents also crossed borders and shores to get here. But let me say to you, you may have forgotten your roots. You may have forgotten that your parents or your grandparents or your great-grandparents were immigrants, but I haven't. I am the proud daughter of Guatemalan immigrants, the wife of Boris, who until recently was a DACA recipient. And I am the niece of a man who has contributed to this country and paid taxes for more than 30 years and put 4 boys through college. This body considers, once again, a budget that leaves working people behind. And I want to, for a moment, talk about immigration and our economy. Because what these colleagues of mine, the Republicans, will tell you is that immigrants are taking from the American people. Immigrants are taking your jobs. Immigrants are taking your housing. They're taking. So let me clarify facts here. The reality is that Republicans are pushing for a billionaire budget that gives $4.5 billion in tax breaks to the ultra wealthy, like, Elon Musk, Jeff Bezos, while cutting trillions of dollars in programs like Medicaid and SNAP. That's not immigrants doing that. That is Republicans doing that. And Republicans have the audacity to tell us that they are doing all these cuts because we are broke. Well, folks, like I said to Chairman Green and Homeland, we wouldn't be broke if the ultra-wealthy would pay their fair share. Fair taxing could fund a budget that centers working families. It could fix our tax system. It could create opportunity for policies that work for working people. And let me also say to you, immigration reform could unleash the full economic power of our immigrant communities to fully participate in a fair tax system. You see, undocumented immigrants paid $96.7 billion in state, local, and federal taxes in 2022. $96.7 billion, that's what they paid. On top of that, undocumented immigrants pay an average rate of 5.27% in federal taxes. That's higher than most of the United States' wealthiest billionaires or mega corporations. And yet, while Republicans give another billion-dollar company another tax break, they're telling us that it's immigrants who are taking from the community and from the people. Well, that's a lie. It's a lie because we understand that 23.6% of all entrepreneurs are immigrants. Some undocumented, some are legal permanent residents, and some are naturalized citizens. $1.7 trillion in spending power is what immigrants bring to this economy. So every time they tell you that immigrants are taking from us, let me be very clear, immigrants contribute every single day. As I'm wrapping up, I want to say that there are many reasons to be concerned, but it's also important to remember that there are reasons to celebrate. So I want to take a moment to recognize a reason to celebrate. Mr. Speaker, I rise today to commemorate the 111th anniversary of the village of Elmwood Park and to celebrate the 25,500 Illinois 3rd Congressional District constituents who call this village home. Elmwood Park is a wonderful place to live, to shop, and to do business. They have built unique intergovernmental and cross-sector partnerships, and I am proud that our commitment and collaboration with President Saviano, the village manager Volpe, and Senator Durbin and Duckworth have secured $13.1 million for a transformative project that included grade crossing improvements to enhance resident safety in Elmwood Park. I want to thank all the hardworking employees of the village whose public service enables residents to access critical services and programs. And I remain committed to continuing to deliver the resources our communities need to improve public safety, create well-paying jobs, and expand economic opportunity for Elmwood Park and across Illinois' 3rd Congressional District. Congratulations, Elmwood Park, for these 111 years of community. I look forward to many more years of partnership and to continuing to fight in the halls of Congress for every constituent in my district. With that, Mr. Speaker, I yield back.